Welcome to the Awakened Voice. According to the Centers for Disease Control and Prevention, 2 more people have died in the United States after contracting pseudomonas aeruginosa, a drug-resistant bacterium linked to eye drops. The death toll now stands at 3. 8 new reports of eyesight loss and 4 reports of enucleation, or surgical removal of an eyeball, have also been linked to the outbreak. The outbreak was originally reported by the CDC in January, and it has now infected at least 68 people across 16 states. The producer of EzriCare artificial tears, a preservative-free, over-the-counter product that many sick patients reported using, recalled it shortly after the warning. Several other eye products have been recalled since then, though not all are tied to the bacterial infection. With millions of Americans turning to eye drops every day, the vast majority of them safely news of the illness and recalls has sparked concern and confusion. Which eye drops have been recalled? At least 4 eye drop products have recently been recalled. Artificial tears from EzriCare and Delsam Pharma have been linked to the bacterial illness. 2 more products, Pharma USA's Purely Soothing 15% MSM drops and Apotex brimonidine tartrate ophthalmic solution 0.15%, have been withdrawn by their manufacturers despite the fact that they are unrelated to the mayor related to the epidemic. According to the CDCA, patients with pseudomonas aeruginosa infections reported using more than 10 brands of artificial tears, but none as frequently as EzriCare. In an email, David Chen, an ophthalmologist at Singapore's National University Hospital, stated that patients need not be concerned about other brands that have not been recalled. He recommends taking general precautions while using fake tears, such as not contaminating them with your fingers and disposing of them within the recommended time range. Pharma USA recalled Purely Soothing 15% MSM drops in March due to concerns that the product was not sanitary. The drops have not been connected to disease, according to the business, but it warns that using infected eye goods might raise the risk of infections that can end in blindness, Apotex Corp. Also recalled brimonidine tartrate ophthalmic solution, 0.15% in March out of an abundance of caution due to cracks in some of the bottles. Infection to watch out for. If you've used EzriCare and Delsam Pharma's artificial tears, look out for symptoms including yellow, green, or clear discharge from the eye pain or discomfort, redness of the eye or eyelid, a sensation that there is something in your eye, increased sensitivity to light, and blurry vision, according to the CDC. The CDC instructs those who are experiencing such symptoms and have used either of the 2 eye drops to seek medical care immediately. People not experiencing symptoms do not need to test for possible infection, it says. A severe eye infection can feel similar to less threatening conditions, such as dry eye disease and other autoimmune or inflammatory diseases of the eyes, experts caution. If it is truly bacterial, a direct eye exam will determine it, since there are certain clinical features we can see that would suggest bacteria and the degree of infection. Dave Patel, an ophthalmologist at the Mayo Clinic in Phoenix. What is pseudomonas aeruginosa? Pseudomonas aeruginosa is an aggressive bacterium that is found all over the environment, including in water, soil, and human waste. It can enter eye drops through contamination with environmental agents during handling, experts say. The bacterium is resistant to most antibiotics and is particularly dangerous in healthcare settings and for people with weakened immune systems. Elizabeth Connick, professor of medicine and immunobiology at the University of Arizona, said that the bacterium secretes proteins that can destroy the clear tissue at the front of the eye, the cornea, and allows it to invade the eye. It can impair vision or even blind someone. Pseudomonas aeruginosa tends to cause problems in places where immune responses are blunted. Robert T. Schooley, Distinguished Professor of Medicine in the Division of Infectious Diseases and Global Public Health at the University of California at San Diego, previously told the Post. But when medical products such as eye drops become contaminated, the concentration of bacteria or viruses or fungi in the product can be extremely high and overwhelm local immune responses, even when people are not overtly immune compromised, he said. Infections can present in ways such as keratitis, sepsis, and respiratory and urinary tract infections. In 2017, the United States saw about 2,700 deaths related to Pseudomonas aeruginosa and 32,600 cases in hospitalized patients, according to CDC estimates. The eye drop-related strain of Pseudomonas aeruginosa has not previously appeared in the United States, the CDC said.